So this week, week 3, we're looking at families of 3 different cultural backgrounds, racial backgrounds out of the African American, Hispanic American, and Asian American families. We're also going to be gaining some more information on treatment approaches, social work practice approaches, that can be used with these groups of culturally diverse folks, and those are the narrative, the structural, and the relational cultural therapies. The learning objectives that we have, hopes that people will attain, is that you become much more knowledgeable and be able to demonstrate cultural ability with these different types of groups, based on your reading and maybe based on your experience as well. That you'll be able to discuss the cultural differences that are important to the treatment process and apply the interventions of narrative, relational, cultural, and structural treatment modalities to these groups. All 3 of these groups have a history of many barriers put in their way in this country that have prevented them from being comfortable and acclimated to living in this country. They have experienced traumas and barriers throughout their lifespan, and those histories come to the treatment setting with you. So it's important that we begin to know more about the background of each of these cultural groups, and how meaningful this is to them when they begin to engage in the treatment relationship with you. We know about the oppression of the Black American family with slavery and systemic racism. We know about during World War II with the Asian families placed in camps during World War II. And we know about the barriers that people from countries of Hispanic origins face when they try to come into this country to leave their worlds of oppression and trauma behind them. So we know about that. But what we don't know is how significant that history is as they seek assistance from the social worker to resolve the presenting problem. And the social worker has to spend some time becoming more acquainted with this history, this unique history that they bring to you. They want you to succeed. They come to you for your skill set. And so engage with them in a manner that is transparent and incorporating them into the full treatment process. They will tell you what they want you to know about their background and the history, that the overall culture experience, and even specific to their own families. They will want you to know about that. But it is really up to us to reach out and have that transparent conversation and relationship with them. So the learning material this week includes this brief lecture PowerPoint transcript, and there's also a required reading in the Congress-Gonzalez text, chapters 11, 12, and 13, that are very specific to African Americans, Hispanic American, and Asian American families. There is a video by Harry Aponte working a structural family therapy session with a family of a cultural background that we are talking about this week. So it gives you an idea of how the application of structural family therapy can be used. There is also a journal article on relational cultural theory and brief strategic therapy as well. There's additional videos for you to watch that will help you in the required reading as well as the recommended readings. Your faculty of the course may augment this material with relevant material of their own to enhance your learning process. And so how we're going to evaluate our learning this week, there are 2 discussion questions. This first one has to do with cultural family groups. We're looking for you to discuss your experiences assisting cultural or racial families that are different than your own culture or race. Do support this discussion with the reading materials. Do talk about how beneficial the reading material was to your knowledge base about working with families from these cultures. And is there any information that you thought was lacking? More information that you thought would have been of benefit? You may use a video to record this discussion post, but as mentioned in past lectures, that if you are citing material, you do have to properly cite in APA format material that you're referring to in your video presentation in the text box in the discussion board in the Brightspace Learning platform. The second discussion question has to do with the treatment modalities that are presented this week, and those being narrative, relational, cultural, and structural family therapies. So we're looking for you to fully describe one of the 3 treatment modalities presented during the week, talk about 1 or 2 of the interventions of those treatment modalities that you would use, and how comfortable would you be in practicing this modality with your clients. Of course, the peer replies are going to ask you to take a look at a peer who had selected a different modality than your own so that you can continue the learning process. And the last method of evaluating your learning this week is a reflective journal about an Asian American family. There is a case in the Congress Journal, Congress and Gonzalez text on page 205 of He Yin, and talking about her role in the family as she goes off to college, and really questioning how her culture can be a benefit or a barrier to her developing as an independent young adult. So we're asking that you reflect upon this case and think a little bit and talk a little bit about how you might approach her to assist her if she approached you. Again, this is between you and your faculty member. It's not published in any of the discussion boards this week. Do share your reflection to the degree that you are comfortable in doing so, as long as you are addressing the aspects of this reflective journal. And lastly, looking ahead in week 5, which is coming up in a couple of weeks, the biopsychosocial assessment assignment is due. The details of that assignment are in week 5. There has been some discussion in the previous lectures about the details of this assignment, using a client from your work or your field. If not, if you don't have one to use, you can certainly use the case that is in the course to help you out with that. Do redact information from live client experiences so that it's not identifying. You do not have to use a current client. You could use one from past experiences as well. And then week 7 coming up is the group practice video assignment. By now your group should have met a few times, have a pretty good understanding of what is expected for the assignment and how the group wishes to approach it. Again, do reach out to your faculty member for the course if you have any questions about the learning material or the assignments, or if you need any clarifying information as well. Have a good week.